Pandemic Awareness. Please review the disclaimer. Welcome to Worksite Safety's Pandemic Awareness course. You are now ready to move on to the first chapter to learn how respiratory viruses make people sick. From virus to illness. In this chapter, you'll compare viruses to other microorganisms. You will also learn about the symptoms caused by respiratory viruses. You will then learn how viruses are passed from one person to another. In the news, we often hear scary and panic-inducing words like outbreak, epidemic, and pandemic. But what do these terms actually mean? Select the icons to learn about these terms. The term outbreak means that there is an increase, often sudden, in the number of people who catch an illness, and that it is above what is normally expected in that particular population in that particular area. This term is similar to the term epidemic, but may indicate a smaller area than an epidemic. The term epidemic means that there is an increase, often sudden, in the number of people who catch an illness, and that it is above what is normally expected in that particular population in that particular area. This term is similar to the term outbreak, but may indicate a wider area than an outbreak. The term pandemic means that an epidemic has spread over several countries or continents, and that it, usually, is affecting a large number of people. Different microorganisms can cause illness in people. These include viruses, bacteria, parasites, and yeast. Each of these microorganisms is slightly different than the others. Select the images to learn more. Viruses are small microorganisms that can only replicate when inside a living cell of another organism. For example, the flu virus and SARS. Bacteria are a type of biological cell. For example, E. coli and C. botulinum. Parasites are microorganisms that live inside or on another organism, the host. For example, tapeworms and the parasite that causes malaria. Yeast is a microscopic fungus made of only a single cell. For example, C. albicans, the yeast that causes thrush. For the purposes of this course, we are focusing on respiratory viruses because they can spread quickly, and they regularly are the culprits of epidemics and pandemics. Examples of respiratory viruses include influenza, the virus that causes the flu, and the viruses that cause severe acute respiratory syndrome, or SARS, Middle East Respiratory Syndrome, or MERS, and coronavirus disease 2019, or COVID-19. When a virus is transmitted to a new person, they are likely to experience some symptoms. Some may be minor, and others may be serious. Select the images to learn about possible symptoms associated with respiratory virus infection. Fever, cough, difficulty breathing, shortness of breath, and/or pneumonia, tiredness, and aches and pains, runny nose or nasal congestion, kidney failure, death in severe cases. Some people are more likely to get severe symptoms from a respiratory virus infection. These include the elderly, those with heart disease or high blood pressure, and those with diabetes. Many people wonder where these respiratory viruses come from. Some viruses are zoonotic. This means they can spread from animals to humans. SARS was spread from civet cats, and MERS was spread from dromedary camels. At some point, a human interacted with one of these animals and became infected with the virus. They then passed it on to other people. After the initial jump from animal into human, respiratory viruses are transmitted from human to human. The most common methods of transmission are respiratory droplets, which is the spray from sneezing or coughing going into someone else's mouth or nose, and close, prolonged contact, for example, hugging or handshaking with an infected person. Select the icon to learn about another potential method of transmission that is less common. Some viruses may survive for a short period of time on surfaces, although the length of time is often unknown. If respiratory droplets from an infected person land on a surface and another person touches the surface and then touches their mouth, nose, or eyes, the virus may be transferred to the second person. One of the main ways that the risk of a virus is measured is based on how easily it spreads among people. Scientists calculate the basic reproduction number, or R0, which describes the average number of people who will catch the virus from one single infected person. Select the icon to learn more. SARS had an initial R0 of 3, which means that for every person infected, they passed it on to 3 people. However, with effective public health measures, the R0 decreased to below 0. When R0 is less than 0, the virus does not continue to spread. A virus has additional risk if it is capable of being spread during the incubation period. The incubation period is the time between an individual being infected and when they begin showing symptoms. Luckily, it is rare that a virus is transmitted during this time. After the incubation period, someone with the virus can transmit it to others. Select the icon to see a special warning. Some people do not develop any symptoms. However, they still have the virus and can still pass it on to other people. Therefore, it is best to follow the preventative measures, presented later in this course, at all times, even when around asymptomatic people. Help stop the spread of fake news. Read the statement and decide if it is true or false. Then, select the character to see if you are correct. Help stop the spread of fake news. Read the statement and decide if it is true or false. Then, select the character to see if you are correct. Help stop the spread of fake news. Read the statement and decide if it is true or false. Then, select the character to see if you are correct. Help stop the spread of fake news. Read the statement and decide if it is true or false. Then, select the character to see if you are correct. Well done! You just completed the chapter. It's time to move on to the next chapter to learn about how to protect yourself from catching a respiratory virus. Protecting yourself. In this chapter, you'll learn about how to protect yourself from respiratory viruses, including aspects such as hand washing and cough-sneeze etiquette. You will also learn about how to protect yourself if you are traveling, or if you are at particular risk, such as pregnant women. Antivirals are the type of medicine used to kill viruses in people who have caught a virus. Vaccines are used to prevent infection by a virus. They are administered prior to infection by the virus. Antibiotics do not help against viruses. Therefore, antibiotics should not be used to treat respiratory viruses. However, if you have a bacterial infection and a viral infection, the antibiotic should be used to treat the bacterial infection. You should keep your distance from others who are showing symptoms of a respiratory virus infection. Select the icons to learn 3 aspects of keeping your distance. Social distancing means that you should not get too close to other people. Instead of greeting others with a handshake or a hug, consider using a wave or an elbow bump. If you are sick, stay home until your symptoms are all gone. Specifically, avoid coming into contact with the elderly and people with pre-existing medical conditions, because they are more likely to get severely ill from a virus. Avoid close contact with any sick people. If someone you know is sick, encourage them to stay home until their symptoms are all gone. If someone near you is Although it is unknown how long certain viruses can survive on a surface, it is best to avoid touching surfaces that may be contaminated and then touching your face afterwards. Select the images to learn more about how to protect yourself from contaminated surfaces. Clean and disinfect surfaces and objects that are frequently touched, such as doorknobs. You can use regular household cleaners or cleaning wipes for this task. Avoid touching your eyes, nose, and mouth. If you touch a surface contaminated with respiratory droplets, you may transfer these into your eyes, nose, or mouth and become infected. Wash your hands frequently, particularly before eating, after using the washroom, and after coughing, sneezing, or blowing your nose. Depending on the situation, you may use soap and water or an alcohol-based sanitizer. Use soap and water if they are available. If your hands are visibly dirty, it is best to use soap and water rather than sanitizer. If soap and/or water is not readily available, you may use an alcohol-based sanitizer to wash your hands. Choose a sanitizer with at least 60% alcohol. You should wash your hands for at least 20 seconds. If you don't want to count, try this trick. Sing or hum "Mary Had a Little Lamb" while you wash your hands. It takes about 20 seconds to get through the song. While washing your hands, be sure to incorporate all 6 techniques below. If you feel that you are about to cough or sneeze, move at least 1 meter, or 3 feet, away from anyone else. If possible, cough or sneeze into a tissue, then throw the tissue immediately into the trash. If you don't have a tissue available, cough or sneeze into the crook of your bent elbow. Now that you know the best ways to protect yourself, let's look at some ways that are not effective. Select the images to learn about ineffective prevention methods. Wearing face masks or multiple face masks, with the following exceptions. If you have a respiratory viral infection, or if you are a medical professional, masks are appropriate. Smoking. Taking traditional herbal remedies. Self-medicating with antibiotics. Minimal scientific studies have been done on women who are pregnant or breastfeeding and who have a viral respiratory infection. However, some important information does exist. Select the icons to learn more. Pregnant women tend to be more susceptible to viral respiratory infections and are more likely to have severe illness than women who are not pregnant. Additionally, viral infections often cause fevers, which can cause neural tube defects in the baby. If a vaccine exists for the particular respiratory virus, pregnant women should get it. Research shows that most respiratory viruses cannot pass into breast milk. Therefore, mothers should continue to breastfeed even if they have the viral infection. This is important because breast milk contains antibodies which help protect the baby against the virus. However, certain precautions should be taken to avoid passing the virus onto the child through respiratory droplets. These include wearing a mask while breastfeeding, or alternatively, the mother may express her milk, also called pumping, and have a healthy individual feed the baby with the breast milk. Viruses affect children with different severity and frequency compared to adults. Each virus is different, and in the case of an outbreak, you should find out more information as it relates to that particular virus. Despite the differences from adults, in general, children should take the same preventative measures as adults. While traveling, you should follow standard protection measures, as well as some additional measures. Select the images to learn about prevention methods during travel. Wash your hands frequently. Avoid people who are sick or who appear to be sick. Avoid animals, such as at farms or live animal markets, and avoid wild animals. Check travel advisories for your destination before traveling. Avoid buffets. Avoid raw or undercooked foods. If you become sick with an outbreak-causing respiratory virus, such as SARS, MERS, or COVID-19, do not get on a plane or public transport. Instead, self-isolate until your symptoms are gone. If you begin to feel ill while flying home from your travels, tell the flight attendant immediately. If you are already at the airport, tell the Border Services officer. Upon arrival in Canada, there may be specific conditions for entry into the country. For example, self-isolation and/or contacting your provincial or territorial public health authority, depending on the virus that you have. Check with Border Services for more information. Help stop the spread of fake news. Read the statement and decide if it is true or false. Then, select the character to see if you are correct. Help stop the spread of fake news. Read the statement and decide if it is true or false. Then, select the character to see if you are correct. Help stop the spread of fake news. Read the statement and decide if it is true or false. Then, select the character to see if you are correct. Help stop the spread of fake news. Read the statement and decide if it is true or false. Then, select the character to see if you are correct. Help stop the spread of fake news. Read the statement and decide if it is true or false. Then, select the character to see if you are correct. Help stop the spread of fake news. Read the statement and decide if it is true or false. Then, select the character to see if you are correct. Well done! You just completed the chapter. It's time to move on to the next chapter to learn what to do if there is an outbreak of a respiratory virus in your community. Dealing with an outbreak in your community. In this chapter, you'll learn what to do and what not to do if there is an outbreak of a respiratory virus in your community. The most important thing to do if there is an outbreak in your community is to stay calm. Panicking never makes a situation better. Turning off the TV, radio, and internet for a short period of time can help reduce the panic felt by seeing the media coverage of the outbreak. However, after a brief break, check the media again for special messages from health officials. There are several things you can do in your home during an outbreak. These include preparing your home for ill family members, communicating your plans, using standard prevention methods, and staying at home when sick, or if it is required by work or school. The next few slides will explain each of these topics. If possible, prepare your home for you or a family member in case you become infected by the respiratory virus. Select the images to learn about ways to prepare your home. Although having a reasonable supply of items such as tissues, toilet paper, and canned goods is recommended, there is no need to buy excessive amounts of these items. This is known as panic buying. Panic buying places strain on supply chains, which are already strained from the outbreak. Only purchase what you need. After creating a plan and preparing your home, be sure to communicate your plans with important individuals, such as family members and neighbors. Select the icons to learn more. Ensure that everyone who is affected by your plan is aware of it. If you have children in middle school or older and they begin to feel ill, they should know to self-isolate in the prepared room and to inform you immediately. If you live alone, you may want to inform your neighbors of your plan. You might want to check in on each other during the outbreak. Follow standard prevention measures even in your own home. These include washing hands frequently with soap and water or an alcohol-based sanitizer, using proper cough-sneeze etiquette, using social distancing and avoiding hugs and close physical contact, and cleaning surfaces regularly with a disinfectant. If you do have guests, encourage them to practice these same prevention measures. If you are sick, stay home from work or school to avoid spreading the virus to others. Use your prepared room to limit the spread to your family. If the government requests that all individuals, healthy or sick, stay home, abide by these rules. Additionally, avoid public gatherings in large groups, whether you are healthy or sick. There are several things you can do at work during an outbreak. These include separating healthy and ill workers, using standard prevention methods, using environmental cleaning methods, and restricting travel. The next few slides will explain each of these topics. One of the most important steps at work is to separate the healthy individuals from those who are sick. Typically, this is done by encouraging sick workers to stay home. There are several considerations for making this happen smoothly. Select the icons to learn more. Workplaces may need to revise their sick day policies to ensure that workers who are ill remain at home. This may include allowing workers to work remotely. Workers should not be required to provide a doctor's note upon return, as this could result in exposure of other individuals at the doctor's office. Additionally, workplaces might need to be flexible when it comes to workers staying home to care for sick family members. Workplaces should communicate with employees about important information, such as revised sick day policies, standard hygiene procedures being implemented, and whether employees have been exposed at work, while still maintaining confidentiality of the individual who has exposed others. Workplaces should contact local health authorities to help decide at what point separating employees is not sufficient, and when all employees should be asked to stay home. Workplaces should encourage workers to follow the standard prevention measures covered earlier in this course. Select the images to learn more. Workplaces should encourage social distancing by asking employees to wave or elbow bump as a greeting instead of shaking hands. Employers should encourage frequent hand washing by supplying soap or alcohol-based sanitizer to employees and posting hand washing technique posters. Employers should encourage proper cough-sneeze etiquette by providing tissues and by posting cough-sneeze etiquette technique posters. It is best to avoid touching surfaces that may be contaminated and then touching your face afterwards. Therefore, employees should be encouraged to clean frequently touched surfaces and avoid touching their faces. Select the images to learn more. Employees should clean and disinfect surfaces and objects that are frequently touched, such as keyboards, mice, and desk drawer. Each employee should clean their own space. Use standard household cleaners or cleaning wipes for this task. Employees should be reminded to avoid touching their eyes, nose, and mouth. Respiratory droplets of certain viruses may be transmitted in this way. Some professions require travel, which may put them at an increased level of risk. Select the icons to learn what companies can do to reduce the risk to those employees. Employers should encourage employees to check travel advisories for the places they intend to travel. There may be restrictions on leaving or on return to Canada if coming from those locations. If employees are already at these locations, employers should encourage employees to check themselves for symptoms and seek medical attention if needed. If the company planning on hosting a large-scale event that brings in individuals from across the country or the world, they should consider canceling the event. This will discourage travel in the attendees. The event could be rescheduled or could be presented through webinars or similar tools instead. When possible, employers should eliminate client meetings or have remote meetings through internet-based means to reduce the number of people each employee interacts with. There are several things schools can do during an outbreak. These include dismissing students from school and ensuring the continuity of education and social services for students. The next few slides will explain each of these topics. When making decisions about dismissing students from school, schools should contact local health officials. They will help them make the decision if and how long to dismiss students from school. Select the icons to learn more. Depending on the advice of local health officials, healthy staff members may be allowed to come to school. This will allow them to prepare lessons for remote learning. While students are dismissed from school, or in place of dismissing students, schools may cancel large events and discourage students from social gatherings, such as getting together with a group of friends at a restaurant. There are several things. It's important that an outbreak doesn't prevent teaching and learning opportunities for students. It's also important that students who receive meals or other social services from schools continue to receive this support. Select the images to learn more. As much as possible, schools should ensure the continuity of education through practices such as e-learning and digital or distance education. Parents should put practices in place at home to promote learning. Schools should plan for ways to distribute food to students who use breakfast programs, such as grab-and-go lunch bags. For students who receive social services, support should be put in place to meet the needs of these students. Help stop the spread of fake news. Read the statement and decide if it is true or false. Then, select the character to see if you are correct. Help stop the spread of fake news. Read the statement and decide if it is true or false. Then, select the character to see if you are correct. Help stop the spread of fake news. Read the statement and decide if it is true or false. Then, select the character to see if you are correct. Help stop the spread of fake news. Read the statement and decide if it is true or false. Then, select the character to see if you are correct. Help stop the spread of fake news. Read the statement and decide if it is true or false. Then, select the character to see if you are correct. Well done! You just completed the chapter. It's time to move on to the next chapter to learn what to do if you become ill. What to do if you become ill. In this last chapter, you'll learn about the steps to take if you become ill from a respiratory virus that is causing an outbreak. If you recently returned from traveling to an area with an active outbreak and you begin to feel ill, self-isolate immediately. This means voluntarily keep yourself in isolation to avoid infecting others. Then, contact the public health authority in your jurisdiction. If your illness is mild, continue to self-isolate until you feel better. If your illness is severe, contact your doctor and follow their directions about where to get treatment. For example, the hospital, or in critical cases, call 911. In some cases, you need to inform the public health authority in your jurisdiction about your illness. Check the website of your public health authority for more information and treatment suggestions. Select the images to learn what to do if you have a mild illness. Don't attend work or school. Avoid public transportation. Keep away from pets. Rest. Take medicine to handle the symptoms. Drink plenty of fluids. Use a humidifier to soothe a sore throat. Follow general protection practices such as cough and sneeze etiquette, hand washing, and cleaning and disinfecting. If you must be around other people in your home or when going to your doctor's office, wear a face mask. Follow general protection practices such as cough and sneeze etiquette, hand washing, and cleaning and disinfecting. If your illness is severe, contact your doctor and follow their directions about where to get treatment. For example, the hospital, or in critical cases, call 911. Try to let them know ahead of time that you have the infection. The medical team may need to focus on supporting the functions of your vital organs. If your illness is severe enough to require hospitalization, the medical team will diagnose your infection and then provide treatment. Select the icons to learn more. Diagnosis is usually based upon the symptoms of the patient and laboratory tests. The laboratory tests are often a relatively painless blood test. Depending on the actual outbreak, the test used will vary because the doctors want to identify the specific virus that is causing the symptoms. Note that it is possible that during the very early stages of infection, the virus may not be detectable through the laboratory tests. This is called a false negative test. Most respiratory viruses are cleared by the patient's own immune system. However, in some cases the patient may need help. There are antiviral treatments for some respiratory illnesses. These medicines help kill the virus. Antivirals tend to be specific to particular viruses, so there is no one medicine that will treat every virus. Additionally, if the virus has caused significant damage to the patient's organ systems, treatment may be required to protect or recover function in these organs. For example, kidneys. The outlook, such as the death and recovery rate or the severity, depends on the exact virus causing the respiratory illness and the age and original health of the patient. With influenza, most people have a mild illness and recover in less than 2 weeks. The death rate is only about 0.1%. With SARS, the death rate is about 14 to 15%. With MERS, the death rate is about 34%. With COVID-19, the death rate varies and requires more research to define precisely. Help stop the spread of fake news. Read the statement and decide if it is true or false. Then, select the character to see if you are correct. Help stop the spread of fake news. Read the statement and decide if it is true or false. Then, select the character to see if you are correct. Help stop the spread of fake news. Read the statement and decide if it is true or false. Then, select the character to see if you are correct. Help stop the spread of fake news. Read the statement and decide if it is true or false. Then, select the character to see if you are correct. Well done! You just completed the course. If you have any further questions about pandemic awareness, contact your provincial or territorial public health authority, or check out the websites of the Government of Canada or the World Health Organization, or WHO.